everyone, and welcome to Health Talk. I'm your host, Jill Fraley Dotson for Pikeville Medical Center. Today we are going to talk about giving blood and the importance of doing that, especially in our community. And hopefully, if you've never given blood before, we'll encourage you to do just that. Let's meet today's guest, Diana Ross. Hello, Diana.
Hi.
You are the Manager of Laboratory Services at Pikeville Medical Center, and Kelly McPhail joining us from Lexington, the Director of Recruitment for Kentucky Blood Center.
Good
Ladies,
morning, Jill.
welcome to Health Talk. Happy to have you.
Thank you.
Dana, first let's start with you. Tell us a little bit about your responsibilities at Pikeville Medical Center.
Well, I'm a manager over the laboratory, which means I take care of our employees, scheduling and that kind of thing. And it covers all our departments, which includes, of course, blood bank, which is why I'm here today. We also have chemistry, hematology, coag, and micro, and pathology, and phlebotomy, of course, that draws our blood samples for the laboratory. So,
Kelly, you are based in Lexington and are visiting with us today from Kentucky Blood Center. Of course, Kentucky Blood Center has many different branches around the state, but today you're here to tell us a little bit about what you do at Kentucky Blood Center.
Well, as the director of the Kentucky Blood Center for recruitment, I'm responsible for 7 recruiters across the state of Kentucky, and those recruiters span out across the state, set up blood drives, organize those, and do a lot of education with donors throughout the state.
Okay. So Diana, let's get into it a little bit deeper now. Give us some background on how blood is used at Pikeville Medical Center. What types of procedures do we use donated blood for?
well, blood is used for procedures, of course, like surgical procedures, because we provide products when a person comes in to have surgery, or if they come in as a trauma, and we use them in the emergency room, and then if they go to surgery. But they're also used probably the most for our medical services department, because those chronic illnesses that cause a patient to be in the hospital for a long period of time, that causes them to not be able to make their own blood as well as they normally would, so therefore we have to support them during that illness. Also, we have a big oncology department that, of course, when you take chemo and radiation, and some of that can affect their ability to make their own blood products or blood for their self and their platelets even. So therefore we have to support them during that time frame while they're ill.
So we need to keep a large bank on
Yes.
hand
Yes.
for those services.
Yes.
How long can blood be stored before it's no longer usable?
Well, for red blood cells, it's 42 days with the ones that they're collecting at this time. For fresh frozen plasma, it's 1 year. For platelets, however, it's just 5 days.
Oh, wow.
Yeah, which is a really short period of time.
Absolutely.
That's why the turnover is so great, and we need those donors to come in so often.
Of course. Now, where does the blood come from that is used at the hospital? Is it just KBC?
It is just KBC.
Goodness,
Yes.
so we need to make sure that bank
Yes,
is full at
yes.
all times.
Yes.
How is it that we go about getting blood from KBC? Is it transported here? Is it from our center here locally?
Well, both.
Okay.
We order also both places. We get it from Lexington, and we also get it from, they keep red cells here at the Pikeville Center. They are in the works planning to keep platelets, so that will help us.
Okay, Kelly, does KBC provide blood to other hospitals around the state?
Yes, we do. We actually supply blood to almost 70 medical facilities throughout Kentucky, and that includes Pikeville Medical Center.
So donors every day are so important for all of your centers
It is.
around the state.
We need more than 400 donors each day to meet all of our hospital needs.
400 each day.
Yes.
My goodness. Diana, how much blood is used by PMC per month?
Usually, I did the average for the last year, and it's a little over 650 units of blood products per month.
Per month.
Yes.
And are those more for the trauma center or for the other services that you mentioned?
Actually, it is more for the other services.
Oh, okay.
Trauma did increase some products, especially, of course, red cells probably a little bit, but also fresh frozen plasma, because for those trauma ones that come in, that's the most severe traumas, we take red blood cells to the emergency department, and we also take fresh frozen plasma. With that, that means we need to take the plasma that is already thawed. So therefore, you have to keep it on hand. So that has added to our blood usage.
Well, of course, last year Pikeville Medical Center became a trauma center that serves our entire region. So has that impacted the amount of blood that we use?
It has, to a degree. Red cells to a smaller degree, but the fresh frozen plasma, actually, we have increased more, I think.
My goodness. Kelly, does Pike County have enough blood donors to fill the need that we have here in our location?
Actually, no. Last year, we registered about 3,500 donors here in Pikeville, or Pike County alone, and those 3,500 donors donated about 4,500 products. And you can tell from the numbers earlier given, we just don't meet those needs for Pike County alone.
All the more reason that we need those donors here in our centers. Where does the extra blood come from when we fall a little bit short for that we need? Where does that come from that we need it to make up?
Okay, it actually comes from other communities throughout Kentucky.
Okay.
Other organizations that's having blood drive. It may be a church, it could be a college community. So when you think of the service area that Pikeville Medical Center has, a lot of the surrounding communities are also helping meet the blood needs of Pikeville Medical Center.
Okay, so Diana, let's talk about different types of blood, because I know you hear people talk all the time about if they are donors or if they're wanting to be donors, and you ask, well, what type blood are you? And I don't even know what type I am.
Oh, really?
I don't know, but I guess I need to find out. But a lot of people don't know what their blood types are.
Well, the most common, of course, and actually that's me, I'm O positive, so I'm one of the most common ones. You have O and A, and in this area, A and O are pretty much equal. A positive and O positive are the most common ones. After that, you get B, and B is not very common.
Okay.
And then after that is AB. Now, to break it down further, you go in the RH. And that means when you say positive or negative.
Okay.
That is the RH antigen or the D antigen, because it is the most immunogenic after the ABOs. So therefore you discuss, are you Rh positive or Rh negative? And most people are Rh positive. If you're Rh negative, we want to go with negative, especially if you're female and childbearing age, because it can affect those healthy deliveries
Okay.
of the newborns, because you worry about hemolytic disease of the newborn.
Now, can those blood types be mixed?
They can to a degree. Now here's the thing, you know how you talk about universal donors? That would be your O's,
Okay.
because O can be given to anyone, okay? But if you're an A, you have an anti-B inside your system that your body just makes. When you're born, you don't have it, but during that first year, you're going to start making it as a newborn. So we have an anti-B if you're an A, so therefore you can't give them B. An A can take O though, because an O doesn't have an A or a B, so an O is a universal donor. You can give that to anyone. Now, the backwards is true if you're talking plasma. If you're talking plasma, an AB individual has no anti-A or anti-B, so that's the universal donor if you're discussing plasma. So.
Sounds like a very complicated process. I mean, I've just been listening to everything you've been saying, and it's amazing to me all of the different components that go into typing and mixing and that sort of thing. So the rarest type of blood is?
AB.
AB.
AB negative, actually.
Okay. And how do you, like I said, I don't know what my blood type even is, so how do you find out what your type is?
It's a simple test at the hospital. We
Okay.
do it in blood bank, and it takes just a few minutes. Actually,
So when you go become a donor, then you can ask them to type your blood then.
well,
Can you do that?
if
Well, you automatically get that as a blood donor.
Okay.
One of the services that we offer to our donors is their blood typing card. So we want our donors to know what blood type they are, so we do that for every donation.
Very good. So Kelly, tell us about donating blood. Who can give blood?
Okay, usually anybody that is healthy. Here in Kentucky, a person that's 16 or older can donate blood with a parental consent, in which we have that form. And like I said, generally they just need to be healthy.
Okay. Is it safe?
It's very safe.
Okay.
The blood equipment is only used one time for one donor, and then it's disposed of.
When you say healthy, we'll step back to that for just a moment. If you have a person who has say, been a cancer patient years ago, a complete remission, not on any kind of meds, can they donate blood?
Yes, there's a time period for different types of cancer. For breast cancer, a woman can donate after remission and after it's been 5 years.
Okay. What about diabetics?
Diabetics can now donate blood as long as they control it with either insulin, diet and exercise, or even oral medication. And what we do, we ask if there's any major complications due to their diabetes that they have, and if that's all good, they can donate.
Perfect. Now, the big question, we want everybody to donate if they can. Where can they go donate blood?
Right here in Pikeville, you can donate at the Kentucky Blood Center, and it's located at 472 South Mayo Drive.
Very easy to find. If you're traveling on US 23 South, it's right there at the red light on the right-hand side if you're going south. Now, let's talk about how often we can give, because you hear a lot of people say, well, I've given this many gallons of blood over my lifetime. Sometimes they're referred to as therapeutic donors. Sometimes they're just people who have such a passion for it. So how often can we give?
Go ahead. Well, whole blood you can give every 56 days,
Okay.
so 8 weeks. Plasma can be given once every 28 days, and then platelets can be given twice a month.
Okay. Now, is there a different process when you go in to give plasma or just to give blood or platelets? Is the process different at all?
Initially, the initial process, the paperwork is the same, the health screening is the same, but if you do plan on donating double red cells or platelets, that process, you actually sit down at one of our comfortable beds, and the needle is inserted into your arm. It goes, the blood goes through a machine,
Okay.
and it goes through a centrifuge where the red cells are, or the plasma is separated, and then the red cells then are returned to the donor. So it is a little bit of a different process than a whole blood donation.
Okay. What about people that are on prescription medications? Are they able to give blood also?
Most prescription medications are okay.
Okay.
There are a few that if somebody was taking right now, for instance, an antibiotic, they're sick, and we
Okay.
wouldn't want them to be donating blood, or sometimes a blood thinner, because that indicates that they have a heart condition.
Okay. How long does the whole process take?
For whole blood, it typically takes about 45 minutes, the whole process. If somebody was going to donate platelets, it's typically about a 2-hour process.
How do you get people to become interested in donating blood? Because there may be people out there that have always wanted to donate and don't know how to go about the process. It's very simple, but those people that are kind of on the fence or afraid, I guess, how do you encourage them to be a donor?
A lot of times what we do is try to educate our donors about the process first off. They have a fear, they're not sure what's going to happen, and so we educate them about the importance of donating for their communities. We also let them know a lot of times about patient stories, because that's sometimes very moving for individuals. All of us know somebody who's had cancer, and so a lot of times it's just giving them information out there, and then talking to them about the process. It's a very simple process.
Yeah. So overcoming fears, it doesn't hurt.
No, actually, our staff will tell you you'll feel a little bit of a stick and a sting. I tell our high school kids to pinch themselves right here at the arm, and that's what it feels like.
It's really not painful at all. What about people who want to set up blood drives around the area? I know that you have mobile units that go to different locations.
We do, and we love new groups coming to us. They can contact our center right here in Pikeville, and just give us a call. We're listed, of course, Google us or look in the phone book, and they can contact our specialist here, and she will set up the blood drive for them.
It's very easy to become a donor.
It is.
One last question for each of you. If somebody wants to be a donor and is on the fence, Diana, what would you tell them?
What would I tell them? Probably 2 things. Number 1, Jesus gave his blood for us. Why not give ours? It's just a little bit of it for somebody else.
You never know when you're going to save somebody's life.
Right. And the second thing, actually, it's kind of like you said, we all have family members who have needed it in the past. And my other thing I guess I would tell, for men especially, hemochromatosis if you have that genetic predisposition toward hemochromatosis, which is too much iron, actually giving blood can help you because it helps your body to pull out that iron and cause you to use it. So it's actually a plus for you. It helps you because it recycles that so that it even helps your body. So it makes you feel better, not just helping others, but it actually helps you.
Kelly, how about you?
I would say number one reason people don't donate blood is because they're not asked. So we want to ask everyone to come out and donate blood. You have to remember it's a little bit of discomfort for a few minutes, but the good it does, it has the potential to help 3 different patients. And so the benefit is far lasting than that few minutes that needle in their arm.
Yeah. And again, I go back to what you said, 400 donors a day
Yes.
are needed to meet the needs that KBC has to distribute blood throughout the state.
That is correct.
It's a lot of people, but a lot of those people, we can save so many lives by just taking 45 minutes of our day.
Exactly.
And you just never know when it's going to make a big difference. Ladies, thank you so much for being here. Diana Ross from Pikeville Medical Center and Kelly McPhail from Kentucky Blood Center, Director of Recruitment in Lexington. Pleasure having you on Health Talk.
Thank you.
Wonderful
Thanks.
information. And if you would like more information about the next blood drive in your area, you can call Pikeville Medical Center at 606-218-4609, or you can call the Kentucky Blood Center in Pikeville at 606-793-4977. Thank you so much for joining us for Health Talk today. I'm Jill Fraley Dotson for Pikeville Medical Center, proud member of the Mayo Clinic Care Network.